everybody. This is Dr. Surindher. I am the Director of Aesthetics Plus Clinics. Welcome to our channel. How do I get fitter arms? Or how can I make my arms thinner? So this is another common query that a lot of people ask us. As we age, and also because of certain other conditions like PCOS or PCOD, people tend to start putting on weight mainly around the arms. Sometimes genetically you can see that people are thin otherwise, but they just have fullness in the arms. And traditionally for that the option is, yes, you can do exercises and diet will help, but certain stages in certain people you will see that the overall body is thin, but it's only the arms which are thick or look out of place, and that is because of the fat collection there. So what are your options for that apart from your regular diet and exercise? So the other option, what we do is we call as liposuction. Liposuction is good for a spot reduction, and that is how we reduce the fat content. Traditionally, the liposuction is done only in the lower arms because that is the one which sags and gives you the jiggly arm or the jiggly arm fat. But we have come to see more and more people, especially those with PCOD, because of the higher testosterone levels, they tend to have a broader shoulders, they have fat collection around the deltoids, they have fat collection on the outer arm, that is on outer arm, as well as on the triceps. So for that you need to address that as well to give you a better toned look for the arm. So this is done typically by liposuction, and the typical liposuction is done by a small incision here where it's only the lower part that is removed. But we also do a lipo of the outer arm and then the anterior and the posterior folds as well, because those all add to the bulk of that shoulder area, and so that is why those need to be addressed as well. Only doing the lower arm does not give you the gratifying results. Of course, in certain patients, when you have a good skin quality or the fat is isolated in one area, then yes, you can go ahead and do that. But overall, most of the times we tend to need to do a lipo of the outer arm as well as around the lateral aspect of the arm and the deltoid region. Many a times you might see that you might have to do the upper shoulder as well to give you a better contour between your shoulders and your arm. So that is between your trapezius muscle here and the deltoid muscle here. So to give you that definition, you might have to do a little bit around here also. So arm liposuction is typically not only the arm, you have to treat the whole arm as a unit. Many times you have to do something around the elbow, because this area the fat comes and collects just like around the knees. So you need to address that to make it more uniform and smooth rather than having a bulge or a difference there. So that is how the treatment for the arms is done. And typically you have a small cut here from where the arms, the liposuction is done, the lower part as well as the outer part. And then you might have an incision in your axilla, that is here, the axillary fold, front and back, to take care of the folds on the front side and the back side. Because many a times you see when you close your arms, there will be a bulge here. If you're wearing a sleeveless dress, then you can actually see this bulge here, and that needs to be addressed as well. So once we do that, and then the posterior, the back fold as well, so that will give you a more toned look for the arms, and it will give you better definition to the arms. Post the surgery, you need to wear a pressure garment, which is like a vest, and that will help the skin to shrink back. You can get back to your exercises in maybe a week or 10 days, and the incision are quite small, and it heals pretty well. the first 2-3 days lifting of the arms might be a little more sore, because we do a lot of lipo around the deltoids. That is where the fat collection, if they have it, and that is why. But usually by the third or the fourth day, you're back to normal. You're doing everything, all your normal activities, and complete healing for the skin to shrink and for you to have the final result. It takes you anywhere between 6 to 8 weeks, or in some cases even 12 weeks. But apart from that, it's a very well tolerated procedure, and the results are quite gratifying. Thank you for watching. If you have any other queries, please definitely mail us or get in touch with us.